Hi, this is Group D, and today we're going to talk about interpersonal relationships between healthcare workers, providers, and patients during a pandemic. We're going to talk about this issue in these four categories. The first is interpersonal relationship in the workplace, and health and safety management in the workplace. Health messenger during a pandemic, changes to interpersonal work relationships due to pandemic.
Patient safety culture, or PSC, is about how employees promote the safety and well-being of patients by their attitudes, ideas, and beliefs. PSC and open lines of communication create a level of trust amongst the people in healthcare settings. So for employees, it helps drive cooperation, productivity, and satisfaction. And for patients, it allows them to trust that the workers will listen to them and their needs. Studies have shown that the more positive the culture is, the better of care is given, less errors will be made, so communication, trust, and relationships will strengthen. PSC will decline if there is a lack of communication. Studies have shown that the importance of leadership being involved because they help establish the culture, which should encourage the reporting of errors so that they can be acknowledged and fixed. The next part of interpersonal relationships that we will be talking about is space syntax. It's a theory and a method that addresses the connectedness between spatial layout and configurations. When physical proximity is close, problem solving and work knowledge tends to occur between workers more. Close proximity allows for more comfort, trust, and collaboration amongst all people in healthcare settings. A shift in workspaces and environments, specifically due to epidemics and pandemics, has an instant impact on interpersonal relationships, but as they adjust to the new environments, people can change that culture. The last section is interprofessional relationships. These are relationships that are formed because humans need to feel a sense of belonging wherever they go. These are interpersonal relationships between workers. In healthcare, it's important because good work relationships create good patient-physician and good patient-nurse relationships. When interpersonal conflicts occur, it is due to not having a clear sense of leadership, stress, and poor communication. Interpersonal conflict literature has split the types of conflicts into two: emotional and substantive issues. Emotional issues are individualistic, dealing with personality problems or how power is managed, while substantive issues are a collective problem because it deals with healthcare practice or the philosophical ideas. Workers are likely to withhold their feelings because of workload. They have no authority. They don't want to cause emotional distress on themselves or others, or because they fail to acknowledge the issue at all. Conflicts are common and seem negative, but research proves it can be beneficial to improve relationships and organizational cultures.
So next, we're going to look at health and safety management in the workplace. With this, we are looking at barriers that need to be conquered in order to bring about change. And so with this, we're looking at before COVID hit. So the first barrier was that management must ensure that they are committed to team improvements, along with providing a sense of community and support within the workplace. Barrier number 2 is addressing the lack of employee awareness. With this, managers should focus less on performance and more on the ways to engage their employees. Now, when we're looking at the barriers that need to be broken down after COVID is hit, the first thing is looking at impacts on the threats of the infection. Secondly is looking at individual health and vulnerability. The third is changes in income with employees. Next is organizational trust between employees and management. And finally, identifying changes in the implications of holding positions of seniority and the job tenure. So when we look at that, ideally we want to see what is the main issue that surfaces when if these barriers are not addressed. So the main issue is that larger amounts of stress and anxiety can occur as a result of a lack of motivation to finish tasks. So healthcare management systems should be committed to developing a strong foundation to ensure they are implementing the best health and safety measures for the organization. However, the most important aspect of ensuring strong health and safety measures during COVID-19 involves a system of providing consistent updates of information to management. The management team also has to ensure that information is being provided about preventing the spread of the virus among their employees.
Hi, here's Winky, and I'm going to talk about the health messaging during the COVID-19 pandemic. Starting from the early 2020s, a new virus showed up from Wuhan, China to all over the world. It only takes 2 months for the United States to shut down the border, and also the global air travel is restricted. A lot of people on the internet encouraging people to wear face masks, wash your hand, social distancing, which play an important role for the early stage of the COVID-19. However, even though there is such a demand for the healthcare workers, the number still decreases during this time because they don't get provided with enough personal protective equipment, and also they have to work overtime with such a low pay rate. And some of the hospitals have the new operation system, which is that when they diagnose COVID-19 patient, they're gonna transport this patient to another the hospital specific for the COVID-19. Along with that, the healthcare workers suffer from the tiredness and also the multiple urgent cases of the COVID-19 patients, and also they have to face the death of the patients all day. And also because the stay home policy, they can't go out and have leisure, and it's hard for them to recovery from the busy work. To help these situations, the state and the federal government issued a new nursing license and credential requirements to expand the number of the employees specific for this pandemic period. For the healthcare organizations, they increase the wages and also the other non-monetary benefits like the child care, help them to relocation, the living, and also the transportations to help them to work. Authoritative experts on social media teaching people how to prevent the COVID-19 dramatically lower the transmission rate. These assistance significantly help health workers get through the hardest time.
All right. So we've looked at interprofessional relationships at work and how they're managed, and we've understood how public health messaging and measures affect the healthcare workplace. So now let's look to unite these themes under the lens of the COVID-19 pandemic. Hospitals can see a huge influx of patients in crisis events, so strategies must be employed to maximize patient care. At the same time, management has to step up and provide a clear hierarchy with clear rewards and punishments. Patient safety culture works because both the provider and manager understand that healthcare is part of a larger picture, but constant, clear communication must be a priority. As external beliefs have become more prevalent in professional settings, it is important for management to keep team cohesion strong. There are many factors that affect job satisfaction, engagement, and motivation, but systems must learn how to work together to elevate patient care in a way that reflects trust and unity in the face of public health crisis. Pandemics have happened throughout history, so the next one is simply a matter of when and not if. It is important for researchers to construct a holistic view of how external and internal factors at the individual level motivate people to set collective goals. Healthcare facilities have to look out for their employees because without educated professionals, the next pandemic will be much harder to control. At the same time, they have to provide a safe space for people to learn about public health. So future research may want to focus on showing how people work together in providing care for each other during a pandemic. This review has shown how interprofessional relationships have changed, how the world has changed around them, and also provides an opportunity for future researchers to drill down further. Thank you.